Should you do it at 60, 65, 67, 70? What should you do about Medicare? If you're currently receiving your Social Security benefits, is it too late to change your mind? What happens if you continue to work? I'm going to talk about all of that today. This is also a live Q&A because there's always exceptions, the exceptions, the exceptions. So if you have any specific questions, make sure you type your question into chat, and I'll go through the list here as quickly as possible so we can get to your individual questions. If you're new to my channel, my name is Ed Weir. I ran the third business Social Security office in the country, so I've taken hundreds of thousands of retirement claims, disability claims, survivors, Medicare, Medicaid. Worked for Department of Medicaid before the Social Security, and a few years ago, when I actually had less hair, I was a sergeant in the Marine Corps. So, welcome to my channel, and let's go ahead and get started. Okay, so for regular retirement benefits, so we're talking about retirement benefits, spouse benefits, the divorce spouse benefit, whatever the case may be. The earliest you can start those benefits is at 62 years old. Obviously, there's no age limit or minimum for filing for disability. And survivor benefits you can actually start at 60 years old, unless you're disabled, which you can start at 50. But we're not going to go into that. We're going to stick on just regular retirement benefits. Okay. However, with anything Social Security, pretty much, if you start your benefits early, then your monthly benefit from Social Security will be reduced. And this goes all the way back to 1935. When FDR started it, Social Security was supposed to be a replacement for lost wages. And if you continue to work, you're not losing your wages. So that's why they have this reduction. And we'll talk about the annual earnings limit and the monthly earnings limit and all the rest of it. Is that reduction forever? Yes and no. So a lot of social media out there that you see, they give you kind of part of it, but there's always exceptions. If you take it at 62, 63, 64, whatever the case may be, before your full retirement age, then yes, your benefits are reduced forever if you continue to receive those benefits. And I'll talk about the suspend and ARF here in a little bit. But generally, if you continue to receive those benefits, you don't suspend or withdraw or anything like that, yes, your benefits will be reduced for the rest of your life. Obviously, you'll get the COLA increases. Everybody gets the COLA increase. If you continue to work, even if you're 62 or 67 or 77 or 107, if you continue to work and to pay into Social Security, and that's one of your high 35 years of earnings, then when you do your taxes, IRS notifies Social Security how much you actually paid, you earned, paid into FICA and all that. And Social Security will do the calculation. If it's one of your high 35 years, they kick out the low one, stick in the new high one, and increase your benefit. So your benefit could conceivably increase twice a year, one based on your high 35 years and one based on that COLA adjustment they do every year. Okay, so work. Because you're filing early, there's limitations to how much you can make. Once you hit your full retirement age, whatever it is, let me go ahead and throw up the full retirement age chart here. So right now, if you were born in 1960 or later, the changes that happened in the early 1980s where they raised the retirement age, that takes full effect this year. So from now on, pretty much everybody 67 is their full retirement age. If you were born in 1957, your full retirement age is 66 and 6 months. And so it increased a couple of months. And now it's hopefully this is it. Although they're talking about raising the retirement age, the president-elect said he's not going to raise the retirement age. He's not going to cut benefits. That's fine. That's great. We definitely support that. Most of us support that. But how are they going to stop the cuts that inevitably will happen if nothing is fixed here soon? But I've talked about that in many, many, many other videos. All right. So the annual earnings test or the monthly earnings test. A lot of people miss this one. Okay. So if you're going to file for your benefits early, that is before your full retirement age, there's a limit to the amount you can make in wages, not investments or 401ks or an inheritance or anything like that. We're just talking about W-2 wages or net income from self-employment. So this year it's $23,400. Anything over that, Social Security holds back $1 for every $2 you go over. So if you go $10,000 over, then Social Security is going to hold back $5,000 worth of your benefits until you hit your full retirement age. So that's the annual earnings test. The first year you can start benefits, the first year you want to start benefits, they can switch to a monthly earnings test, a monthly earnings limit. And basically, what it is, let's say you start your benefits in July, and up until January and up until June, I always exaggerate for effect here. You make $1 billion. From January until June, you make $1 billion. But starting July, when you start your benefits, you're not gonna work anymore. Or the monthly limit is $1,950 for 2025. If you stay under 1950, which is 23,400 divided by 12, if you stay under 1950, then you're good. As long as you stay under the monthly earnings limit for the rest of the year, you can continue to receive your Social Security benefits and continue to work as long as you're under that. But I got to warn you that the computer system sometimes, if it depends on if you file online or you get call and schedule an appointment, Social Security employees often mess this up. They're supposed to in MCS, they're supposed to code the NSM screen, and you can tell I've done this a few 100,000 times. But anyway, sometimes there's people throughout the country, employees that code it wrong, and what happens is the result is next year when you do your taxes, Social Security will say, "Hey, this person made $1 billion, and so you owe us all that money back." And what it was is the employee didn't code the system correctly. So easy, easy fix. Don't worry about it. Just go down there and say, yeah, yeah, yeah. I made the $1 billion before I started my Social Security benefits. After I started my Social Security benefits, I stayed under the monthly limit, and they'll correct it, and it's easy fix. And then say, hey, by the way, you need to tell that person they need training on anyway. But anyway, all right. So that's only the first year. In the following year, then you have to stay under the annual earnings limit. You can't have a monthly earnings limit 2 years in a row, okay? Or you can only use it one time, essentially. Okay. All right. So what if you say, oops, I shouldn't have done that? Or you file for benefits because you quit your job, and then after a week, like me, you decide, well, I can't retire. It's impossible to retire. So you go back to work and try something else. No problem. There's a few ways to stop your benefits. One way is called the withdrawal. So basically, you contact Social Security and say, yeah, I want to withdraw my application. It has to be done within 12 months of when your benefits began. So within 12 months, you can completely withdraw your application like it never happened. And because it never happened, you shouldn't have received that money. So you have to pay all that money back for 12 months. So that's withdrawal. And the withdrawal application, you can say, I want to withdraw, and that means nothing until you actually write a check and pay that money back. So once the check is cashed, then the application withdrawn. And in the future, if you want to go and restart your benefits, you have to file a brand new claim, but it's like the first one never happened. Okay, so that's one way. Another way, if you change your mind, you just go back to work. You get, you get more money or whatever the case may be. You get over that. You can actually suspend your benefits. How do you do that? You call Social Security and say, "Hey, I'm going to make over, what I thought I was going to make. I'm going to make, 10, 20, 30, $40,000 over." So they will do a work report, and they will essentially suspend your benefits. So you won't receive however many checks until the $1 for every $2 or whatever goes over. So that's a suspense. And people say, well, then I'm going to lose those checks. Well, you're losing the actual checks. But what happens is when you hit your full retirement age, then the Social Security computer system looks at your account and it says, okay, John took his benefits 30 months early. So when he was actually receiving his benefits were reduced by 30 months, because every time you take your Social Security early, every month you take it early, it's reduced. People think, it's only, January or birthday. No, it's every month you take your benefits early, it's reduced a little bit. So if you take your benefits 30 months early, it's reduced by 30 months. But then let's say you go back to work, and after 10 months, you don't receive the rest of the 20 checks. So when you hit your full retirement age, the computer system looks at that and says, hey, John is reduced for 30 months, but he didn't take 20 of those months. So they unreduce the benefit. So when John gets his check after full retirement age, it's only reduced by 10 months, the actual amount of months that he actually started receiving benefits. And that's called the ARF, the adjusted reduction factor. And that's 100% automatic. You don't have to do anything about that. What about 65? People always think full retirement age or whatever is 65. The only that changed in the 1980s. It was 65. Retirement age was 65, going all the way back to 1935. They just did that because we copied the German system and it was 65 in Germany. But anyway, um, but 65 is no longer relevant except for Medicare. So for Medicare, you have to sign up for Medicare at 65, unless you have credible coverage. What's credible coverage? That is if you or your spouse are currently working, not the Affordable Care Act or Obamacare or COBRA or a retirement plan, a health plan or whatever. It's through current work, yours or your spouse's, and your employer has 20 or more employees. If you have that, you do not have to sign up for Medicare. But if you don't have current health insurance from current work, yours or your spouse's, then you do have to sign up for Medicare. If you don't, then you will be penalized 10% for every 12 months you did not have health insurance. And you also get penalized for Part D, the prescription drug plan. Um, and once there's 11,000 people turning 65 every day in the United States right now. Yeah, we're at the silver tsunami, as they call it. And when you get Medicare, then you have to figure out what you're going to do because Part A is zero premium for most people. Part B this year is $185. Part A covers the hospitals. Part B covers the doctors, but there's a lot of gaps there. The biggest gap is Medicare Part B only covered 20%. So if you go into the doctor and get a $100,000 Band-Aid, you have to pay $20,000 of that 20%. So that's why people either get a Medicare supplement plan, which is the ones I recommend you evaluate first, see if it's right for you, a Plan N or a Plan G, or a Medicare Advantage plan. And if you get a Medicare supplement, you also need a Part D, a prescription drug plan as well. So you can call my partners at Chapter and they can help you out. And this is also the open enrollment period too. So if you signed up for a Medicare Advantage plan and you found out it's not the one you should have signed up for, no problem. You can change it. Just call up a Chapter and they can see what's available in your area and get you into something that might be better for you. And they 100% free. So, all right. So, but going forward, the full retirement age, once you hit your full retirement age, and again, this time it's 66 and 8 months or 67 going forward, then no more limits in terms of work. You can go back to making $1 billion a month and continue to receive your Social Security checks. Once you hit your full retirement age, there's no more limitations whatsoever. And if for those people out there on disability benefits, once you hit your full retirement age, your disability benefits, for all intents and purposes, kind of end, but your money continues. So basically, what it is they stop taking your money out of this disability trust fund and start taking it out of the Social Security trust fund. So it's just a bureaucratic, accounting thing. Your benefits stay the same, your direct deposit stays the same, but you're no longer limited to how much you can make and no longer get those CDRs, the continuing disability reviews. One thing you can do, you've probably heard of delayed retirement credits. So delayed retirement credits is if you wait until you're past your full retirement age. So let's say your full retirement age is 67. If you wait to collect your benefits until you're 68, you'll get 8% added on your full benefit amount. The full benefit amount is always based on your full retirement age. It's called the PIA, primary insurance amount. But you get 8% added on. So if you wait 3 years and you start collecting your benefits at 70, and please, nobody should start their benefits after 70 because you're losing money because your benefits don't increase the month you turn 70. So if you wait until 70, you're getting a 24% increase. So let's say your benefit amount at your full retirement age, let's say, is $1,000. If you wait until 70, you're going to get $1,240. Okay. And there's one thing a lot of people don't know. Another way you can basically suspend your benefits is just before you hit your full retirement age, you can suspend your benefits. It's called the voluntary delayed retirement credits. And just before you hit your full retirement age, you call Social Security and say, suspend me. I want to get delayed retirement credits. I've already been getting a check, but I want those delayed retirement credits. So suspend my benefits and I'll call you back next year or 2 years or 3 years down the line and you'll get those delayed retirement credits. But I have to warn you on that. Not many people do this, and probably because people don't know. But the employees at Social Security don't know this. So if you call up Social Security and say, "Hey, I want to do voluntary delayed retirement credits," they will probably, think you're crazy. But you just have to push a little bit and say, "No, it does exist. Look in the Palms policy, and you'll see voluntary delayed retirement credits." And so they'll find it. Don't worry about it. Or you can come back here and we'll walk you through the process. All right, so we did that fairly well, and I know there's millions and millions of variations of people that say, "Okay, what about this situation? What about this situation?" And that's why we will do a live Q&A starting right now. Let's see, someone says, "Wait until you are 70." Yeah, that's whether you should wait. That's a completely personal decision. Um, let me pull up here. Okay, so when you retire is, basically, should you do it at 62, 65, 67, 70? Number one thing, do you need the money? If you need the money, then, the earliest you get the money, that's the best thing, right? So, um, but if you need the money and you're also working and they're going to hold back those benefits, then that's another, consideration. Do you have auxiliaries? What are auxiliaries? If your spouse is waiting for you to collect benefits so they can start benefits on your record, then maybe a good idea to start early. If you have children under the age of 18 or that became disabled before the age of 22, it's called disabled adult child benefits. If they can start benefits once you start your benefits, then it might be a no-brainer. A lot of people say, "Well, I think I'll wait till my full retirement age, because I'll get more money." But then they have two small children, and it's like, okay, but you're also going to miss those checks for the next 1, 2, 3, 4, 5 years. So they say, "Oh, okay, well, yeah, let's start it now." Your health. Are you healthy? If you're not healthy, then get your money. Get while the getting's good. Genes. If you all your family lives to 110 years old, might be best to wait till 70 years old. Taxes, is getting benefits early, is that going to put you on a higher tax bracket? Not most, about 40% of people don't even pay taxes on their Social Security benefits. That's why the next president is talking about ending taxes on Social Security benefits, which I agree with, but it's actually not going to help the people that you think it would help, because the people that just live on Social Security don't pay taxes anyway, and it's also going to reduce. It's also going to get us more cuts in the future from our Social Security checks because it's going to deplete the trust fund quicker. So, or if you want to get your money early because you think you can, invest it better than Social Security, go for it. And the last one is what I've just started adding recently is the political situation. It doesn't matter who the next president was. It was going to be. We have been kicking the can down the road for decades on fixing Social Security, and we haven't done it. And I think time is ran out. So we need to do something immediately, if not sooner, to fix it. So if you're looking to retire here, I suggest you reach out to your politicians and say, "Hey, what are you doing to make sure, I've spent all my life, filing for benefits, and now they're looking to be cuts here in the next few years. What are you doing to fix that, to make sure that doesn't happen?" My recommendation is to smash the FICA cap, and I've got tons of videos on that. And also ask them what are they doing to help improve customer service, and most importantly, what are they doing to fix Social Security so there are no automatic cuts here coming soon. All right, so yeah, reach out to your politicians. All right, let's see. All right, Ruthie. So if you start Social Security benefits at 70 and continue to work, does the earnings limit go away? The earnings limit goes away once you hit your full retirement age. So if your full retirement age is 66 or 67 or whatever the case may be, no more earnings limit once you hit that. So yeah, if you're 70, then you can earn $1 billion a month and it doesn't affect your Social Security negatively at all. Hope the hockey game is watching. There's a minute left. Okay, hopefully your team won there. If you start collecting Social Security before 67 and make $200,000 while collecting early, which causes you to forfeit all your Social Security received, will you get back amount forfeited? Yeah. So that's what I talked about, the adjusted reducement factor. You don't get all those checks back. They don't say, hey, we withheld, you know, 10 months of $2,000 checks. So here's $20,000, the money we held back. No, they don't do that. They just unreduce for those number of amounts of months. Yes, please share and like. Helena, hey there, Dr. Ed. Hey, what's up? Thank you for the invaluable information. My wife and I own a rental property. My wife is a real estate professional. Would the rental income affect my Social Security benefits if I retire at 62? It really depends on what you do, how you and your buddies at the IRS, decide. Your tax accountant decides. If Because she's real estate, so that if that is her job, her business is to do whatever that is, then that'll be net income from self-employment. So, but if it's not net income from actual self-employment, it's just a side thingy. So it really depends how you categorize it with the your buddies at the IRS. So for most people, like a rental thing like that, or inheritance or winning some gambling and stuff like that, it doesn't that's not considered earned income. So it doesn't affect the annual earnings limit or anything like that. But there's exceptions, and the exception for real estate is if you're a professional real estate person, and that's your job is to do that. Then it's part of your business, and you have net income. If you're a professional gambler, and that's your job is to play Paiga or Texas Hold'em or whatever, then that's your job, and so that is net income from your business. So, Kim, is 65 a good age to collect your Social Security if I've been out of work for a long time? I don't plan on going back to work. Should I go ahead? Yeah, it's really 100% your decision based on kind of the questions. But you do have to, you're 65, you do have to address the Medicare issue. Whether you want to start your benefits, that's a whole different thing that you'll have to decide. But you do have to figure out Medicare here. All right, so for 65, for signing up for an application for all of this at your 65. So if you just want to go ahead and get Medicare, just file for Medicare and you restrict your application. So that is, you just say, hey, I just want Medicare Part A, or I want Medicare Part A and Part B and no money. So if you want to start your benefits, your money benefits at 67 or 70, but you have to sign up for Medicare, you just sign up for Medicare. And then as part of the application process, you just put, no, I just want Medicare, Medicare only, just Part A only, or Part A and B, and just do the money later. If you are currently receiving Social Security monthly benefits and you're about to turn 65, then your Medicare is kind of automatic. So if you're receiving benefits, spouse benefits, divorce spouse benefits, surviving spouse benefits, retirement benefits, about 3 months before you turn 65, Medicare will send you your package in the mail, and it'll have your Part A and Part B card in there. If you have health insurance from current work, you have credible coverage, then you can just refuse the Part B. You can't refuse Part A. Most people can't. But that's zero premium anyway. But you refuse Part B and you just send the card back and you won't be charged the $185. But if you want it, then you just keep the card. And then you have to go find a way to cover all of those gaps and reach out to Chapter, and they can help you with that. Sally, I am 64. Husband is drawing Social Security now. So can I draw a spouse half of his Social Security with reduced amount since I am not FRA? And then at FRA, get my higher Social Security amount? No. They changed that law in 2016, so you can't do that. You have to file for benefits on your own record first, and then you file for spouse benefits off of your husband's. So if you're not, so you're 64. So if you do that now, then your benefits are going to be reduced. Your benefits on your own record are going to be reduced, and the benefits on your spouse's record are going to be reduced because you're not your full retirement age. But he also has to be receiving benefits. So for you to receive benefits off his record, he has to be receiving benefits. Can I withdraw from a retirement account which is raised Emma B reconsidered. Emma raised Emma B. Can I withdraw from a retirement case which raised Emma be considered? Not sure what. Are you talking about IRMA, the income related monthly adjustment amount for Part B? Yes, those. That's not the different. There's a different calculation. There's a modified adjusted gross income for that IRMA, and what that IRMA is basically if you have Part B and Part D, and you're a high income earner, and that's from wages or net income or withdrawals or capital gains, then you might pay more Part B, a larger Part B premium than other people. And yes, that just might be considered as part of the modified adjusted gross income. Dan, have you ever had two people that were issued the same Social Security number? Yeah. Well, not necessarily issue. Well, there was a case back many years ago when I talked about this yesterday. There was this a wallet manufacturer that decided to put Social Security, a fake Social Security card in their wallet to show that a Social Security card would fit. And but the president of the company decided to use his secretary's real Social Security number. So about 40,000 people were using that same Social Security number. Yeah, that took decades to figure out. So, question asking for someone else. Noreen, you are too awesome. That's exactly what we like. We like for you to reach out and say, well, none of this applies to me. Ed, you're wasting my time. No, don't be so self centered. Be like Noreen. Think about all the people you know in your orbit, 7 degrees of Kevin Bacon, your neighbor and neighbor's neighbor, and see if you can ask some questions and help them. And then press like and subscribe and share and all that kind of stuff. And because you don't know, pay it forward. Okay. Thank you, Noreen. If a spouse starts collecting the Social Security at 62, then suddenly passes, will the spouse receive a reduced survivor's benefit? Yeah, because there's a lot of variables with survivor benefits. It's when the survivor starts those benefits. If the survivor starts their benefits, those survivor spouse benefits at their full retirement age, let's say 67, then they will get 100% of the benefit amount. But the benefit amount it's probably going to be reduced because that person was taking their benefits early. If they didn't take it early, they would receive benefits. The benefit amount would be the benefit at their full retirement age. If the person was waiting till 70, they get those delayed retirement credits. So yeah, there is going to be a reduction because the person started taking those benefits early. And there's also things called the widow's limb, WIBLIM, WIBLIM. It's basically a limitation that if your deceased spouse did take those benefits early, then there's a different calculation that they might be able to give you a little bit more. But your benefits don't increase anymore after you turn 62 and a half. So there's some people out there that didn't collect their surviving spouse benefits because they're waiting till they're their own full retirement age, which they shouldn't because their benefits are not going to go up anymore based on that law. And how do you figure out whether that's you? You call Social Security and try to get through. And while you're waiting to get through, you call your politician and say, "How come I have to be on the phone for 3 hours? Support Social Security. Make sure they get some employees so they can answer their phones." So you call Social Security and say, "Hey, I'm 62 and a half here soon. If I start my survivor benefits, how much am I going to get, starting now? If I wait a year, how much am I going to get?" And if they say, "Well, if you wait till next year, it's actually going to be exactly the same. It doesn't increase, except for COLA, obviously." But then you'll know that you're part of that RIBLIM type of category there. Yeah, that part is kind of confusing. I understand. Nancy, what are your thoughts on removing the ceiling contributions for high earners? Would this help the trust? Yes, that's the one thing I talk about on a regular basis. The thing I mentioned in the smash the cap, and basically, if you're new to the channel, we need a mass movement on this. Basically, if you make up to $176,100 a year, you pay FICA Social Security on every dollar you make. If you make over that, you don't pay FICA on Social Security anymore after that amount. So if you make $5 million, then the other 4 million and whatever, you don't pay FICA tax. The rest of us, Joe Schmoes, do. We have to pay FICA tax on every dollar we earn. But yeah, so if they smash that cap, that would go a long, long way to making sure we don't have cuts in the future. But yeah, but the problem with that is the people, those 500 and, the 435 House representatives, the 100 senators, the presidents, that handful of people are kind of, yeah, um, dedicated to not paying that. And their supporters, the billionaires, the millionaires, don't want to pay like the rest of us. And so they're going to fight us tooth and nail to make sure they don't. And then they're going to say, well, the only alternative, we've tried nothing and we're all out of ideas. So I guess we're just going to have to raise the retirement age or cut benefits or just give your money over to Wall Street. So, but we're going to make sure that doesn't happen by calling your politician and make sure it doesn't happen. All right. I'm jumping around a little bit here. My friend to his staff at 62, then he got a job making $2,000 per month. What should he tell Social Security? Okay. My friend, to start at 62, then he got a job making 2,000 a month. Um, all right. What's up, Melvin? So if he's that close, so we're talking about 24,000 and the limit is 23,400. So you can, and if you're just going to be a few $1,000s over, there's a couple of strategies you can do. You can call Social Security and say, "Hey, I'm going to make more than 23,400." And what they'll do is they'll suspend 1 month or 2 months or however many months the one for $2 is over. Um, or the other strategy, if you're kind of in that gray area like that, is just forget about it. And then because $2,000 a month now, but maybe in November, December, less. Cuts back. Takes vacation or something, and then you stop your benefits for nothing. So just let it go. And then when he files for his taxes next year, and if it turns out he's $1,000 over, then Social Security will send him that nasty gram and say, "Hey, you owe us $500, $1 for every $2." And at that time, you just go ahead and pay it. So if you're going to be kind of close, and oh yeah, I'm going to make $1,000 over, and I know I'm going to have to pay $500. So here's that extra money they would have withheld, and I'll just stick in the bank and I'll pay it. Or you could be even smarter, and then when you get that notice next year that says you have that overpayment, then you say, you set up a payment plan, and it's zero interest, so it pays to set up a payment plan. So free money for a little bit. So that's a smarter way to do it, but that's a insider trick. I'm 65. My wife is 62. Can she take Social Security now and then takes the spouse benefit when I claim at 68 and she turns 4 off? Yep, absolutely. So yes, so that's called a split strategy. She starts, the lower earning spouse takes their benefits early. And it's going to be reduced because she's filing early. If she is full retirement age when you start your benefits, then she'll get 50% of yours, but hers will still be reduced. So the total amount will be reduced. But she'll get the 50%. So, yep, that's a split strategy. Very, very common. Dr. Ed, my husband's FRA is in June. So when should he apply for benefits? If he applies in January, you can't apply in January because you can only do like 3 months in advance. Is he still going to get the full benefit because he's 67 birthday year? No. Anytime you file for benefits early, whether it's 1 month, 2 months, 3 months early, your benefits are going to be reduced. You won't get the full benefit amount. But if he waits until June, he'll get the full benefit amount. But you know, it's only a few months early. Most people take it because, if the reason he didn't take it prior to this year is because earned too much last year, but now it's not an issue. Because this year you can, if this is your full retirement age year, you can earn $62,160 in the months before your full retirement age. Anything over that, Social Security holds back $1 for every $3 you go over. So yeah, I would check it out. And if he wants to start his benefits in January, it'll be a few months early, but it'll be reduced a little bit per month, but you'll also get all those checks, another 5 or 6 months worth of checks. So that's always a beautiful thing. Pickleball Paul, thanks for your survey. You're welcome. Is Medicaid and SSDI the same thing? No. If not, can you get both? Retiring in June 25 at 62. When should I apply for SSDI before my actual retirement? So SSDI is disability, Social Security disability insurance. That's a completely different animal. If you're disabled, unable to work because of a disability, you can start your SSDI now. You can apply right now. Your sounds like you're talking about just regular retirement benefits, and yeah, then you can do that 62. Medicaid is a healthcare program administered by the states. Medicare is the one you go into Social Security and apply for, but Medicaid is a welfare-based program. And yes, you can receive SSDI and Medicaid. You can receive SSI, which is the welfare based program, supplemental security income. You can receive SSI, SSDI, Medicare, Medicaid, a Medicare Advantage dual eligible plan, extra help with the prescription drug plan, the Medicare savings plan. You can one person can receive all of those things. And one of the problems is, people don't know of the stuff that they're missing. And that's unfortunate. And I think that's one of the reasons why Congress doesn't support Social Security to get help so you can get help navigating the nightmare that is the bureaucracy that they built. They don't want you to get help because they don't want you to get your benefits, and so essentially cuts are happening right now. So cuts are going to happen in the future. That's guaranteed if nothing is done. But people are getting their benefit cut right now because they don't know what they don't know. So that's why I'm here doing these things. So please share, subscribe, and all that. It used to be 66 for full benefits. Now I think it's 67. That is correct. Yeah, it used to be 65. I had identity theft and someone was working under my name in New York. I live in California. Now SSDI is making me pay back the overinsurance for the past 2 years. What can I do? You can you can appeal that, file an SSA 561 request for reconsideration. So basically what happened is someone stole her social security number, was working and paying into social security, and that increased her benefit. And, she probably didn't know. Oh, my benefit increase. I guess that's a COLA increase or, whatever. But yeah, the benefits increased. And now they say, hey, they found that person, took those earnings off her record, and found out she had been paid more over the last 2 years. So I would file a reconsideration, or actually probably not a reconsideration on this one. I would do a waiver of the overpayment, an SSA 632. And in order to get your an overpayment waived, two things have to be met. One, it's not your fault, and two, you don't have the ability to repay it. So this doesn't sound like it's your fault. And question is whether you have ability to repay it. If you've got $1 million in the bank and you owe Social Security $500, they're going to want their money. But if you don't have the ability to repay it, even some type of payment plan, then hopefully they'll waive it. So definitely SSA 632 request for waiver of overpayment. Hopeful. I was on SSD, Social Security Disability, for about 5 years before I reached 65 and was put on straight Social Security. Does the new law have any effect on me? It, if you were, yeah, you're talking about the Social Security Fairness Act. If you worked in a non-covered entity, that is, you worked for a state or local government that did not pay into Social Security, then possibly. So, but if you didn't, no. David, will the Social Security payments that a DAC is a disabled adult child, someone that was disabled before the age of 22, that a DAC child is receiving from the lower earning parent now affect Medicaid when they take from the higher earning parent when they start Social Security? Okay, so good yes, you got that straight. So the child is receiving benefits from one parent, and now the other parent is going to start receiving benefits, and the other parent's benefit amount is higher. So you definitely want to switch to the higher benefit amount. But that's a whole different thing in terms of Medicaid from your state. So if that child is now going to be receiving, it's impossible, but let's say the child is going to receive $3,000 a month. Well, it's actually, but you would have to be deceased to get or a child to get that. But anyway, because a disabled adult child gets 50% of your full benefit amount or 75% of your full benefit amount as a survivor. But yeah, Medicaid rules apply. That is, if the child's income increases, then Medicaid will take that into consideration. However, it depends on the state. I've had people that were receiving disability in one state and the state didn't count their disability benefits, and they moved to another state and the other state did count those disability benefits. So one they had Medicaid and then they moved and they lost Medicaid. So you really have to reach out to your particular state Medicaid office and say, "Hey, my child is going to start receiving X amount of money. What's the effect of that?" So can I apply for my Social Security retirement at age 68 and suspend benefits until 70? Will I get delayed retirement credits through 70? Yeah, yes. Um, but if you apply, well, not at 68, you have to do it before your full retirement age. So can I apply? So you just don't apply. Yeah. So if you haven't applied yet, and you want to wait till 70, then just don't apply. Michael, thanks, Ed. Yeah, you're welcome. Um, My friend took Social Security at okay, I already answered that one. Let's see. Tim, I am 66, retired, waiting to draw Social Security until 66 in 10 months. My wife is turning 65 and retired. She is going to draw early. Is it automatic when I draw that she goes on my record? No, it's not automatic. She actually has to, when you file for benefits, if you're doing it over the phone, you go through the whole application, answer all the questions to the claim specialist employee on the other end of the phone, and then when they say, "Okay, we're all done," you'll say, "Oh, no, we're not." You hand the phone to your wife, and your wife files for benefits. So easy, 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 relatively, if you can get in. Nancy, retiring at 62 in April, will work part time. Is the 1950 earnings limit for the money I actually earn in a month, or the total of paychecks in a month? Um, Yeah, you can, sometimes, yeah, it gets kinda touchy in the computer system. The Social Security computer system usually doesn't catch that, but you can kind of average, sometimes, payday is on a Sunday, so they give your checks a couple of days early, and it turns out you get 3 checks in a month. Yeah, you can they can do an averaging type of situation. So if it turns out I wouldn't sweat it, when you do your taxes next year. And Social Security sends you that nasty gram that says, "Hey, you said you're going to be under 1950 a month," but the computer system doesn't really catch that, to be honest, because when you file your taxes, do you tell the IRS how much you made in a particular month? No. So that's how Social Security gets their information, is from the IRS. So I wouldn't sweat it. But if for some weird reason they said you made more than 1950 a month, you just go down there and says, "I just got this check, for a few days early," and they'll just waive it or just delete it out. So I'll be retirement age in 2026. Can I get the full amount and still work? If you're your full retirement age, yep, absolutely. John, suppose I start receiving benefits in February. I am a sole proprietor and had a windfall profit in January, but my FICA reporting is annually. How do I support my monthly earnings claim? Support your monthly earnings? No, I'm not sure what you mean there. So yeah, if you made $1 billion in January, doesn't matter because you're going to start your benefits in February. So you just say, "Hey, yeah, I got a whole bunch of money in January, but it was for a previous yada yada yada." As long as you stand with kind of they with self employment, they kind of do a little bit different. But self employment, being self employed, it's a nightmare to do anything, get a loan, and all this, proving this and all that because you're self employed. In the old days, about what 10, 15 years ago, they had this thing called a QR, questionable retirement, where Social Security employees, and myself included, I used to have to do this. I hated doing this. They said, you're self-employed, but you're working, but your earnings are going to your kid or your spouse or something like that. So we think you're actually working and making over. And that was always a nightmare. And it was a nightmare to, adjudicate and decide and all that stuff. So they got rid of that law. So, um, Yeah, so you should be good if as long as you stay under the monthly limit going forward, if this is your first year. But if it's not your first year, then that annual is gonna count, but it looks like it's your first year. Anonymous, a friend of mine retired from the FAA with an FAA pension in lieu of Social Security. His wife retired as a hospital nurse, and she collects Social Security. Can he collect FAA pension and get spousal benefits from wife? So it sounds like, yeah, in lieu of Social Security. So this sounds like it's a non-covered entity that he worked. This is a federal government that he worked before the 1980s on the old system, the CSRS. So the new Social Security Fairness Act applies. So if you would ask me this question last week, I would have said no, but this week, yes. Um, I asked my local office about withdrawing. It will take up to 4 months to do the process, and then there are tax implications if you already did your taxes with Social Security benefits you earned. Yeah, yeah, tax issues because you got the benefits, but then you're going to pay them all back, and then yeah, it's but that's an IRS. I don't touch IRS type stuff. Um, the 4 months thing, yeah, that's crazy. But if it takes 4 months, I guess it takes 4 months, but again, the most important thing is you withdraw the application, they send you the letter that says, "Okay, you have to pay back X amount of money," you pay that back, and then it's done once they file that, but what happens to your eventual Social Security payments if you go back to work after receiving SSDI for 8 months or 18 months or more? What happens to your Social Security payments? Well, if your benefits are stopped because you go back to work, then your benefits are stopped. So, and then later on, if you decide to retire at 62, 65, 67, then what you received in SSDI has no effect on that in the future. Wanda, let's give the yes, please, thumbs up. Thank you. I've been retired since August 2024. If I go with the withdrawal option, yeah, you can't be well, August 20. Oh, okay. Well, okay, time. Yeah, never mind. If I go with the withdrawal option, maybe going back to work, do I have to pay it all back at once or can I set up a payment? No, you have to pay it all back at once. Yeah. So yeah, you're within your 12 months, so you're good. Um, duh, duh. Terry, I will be at full retirement age in April. I filed this month for Social Security, but I will continue to work with my benefits. Will my benefits go up? Yes. Based on COLA, yes. And if, this year's or next year or 10 years now, it's one of your high 35 years, then Social Security will automatically recalculate and give your benefits an increase. I got forced into applying for Social Security at 64, 3 months because of a health issue. Okay. My full retirement is not until 67. So after this health, is it better to go back to work, suspend? So it really depends on your particular situation. Yeah, really depends. So yeah, you can suspend your benefits and those months will be added back into your calculation for the rest of your life. My wife started Social Security in October. Apparently, no taxes have been taken out. Yeah, Social Security does not take out taxes. You can, it's called a W-4V, the voluntary tax withholding. And how can we start taxes taken out? And do we not have a year's worth owed next year? I still work. Yeah. They don't take out taxes automatically. You can actually, they just changed it where you can call the 800 number again if you can get in, and you can do that over the phone. You can tell them to start taking 7%, 15, 22% or whatever out of your Social Security checks. So, and what happened before that, then, yeah, that's between you and your buddies at the IRS, I guess, right? Medicare costs you all the way around. Money here, there. What's the use? Yeah, and what's the use until it's like car insurance? Yeah, I paid with all the money I paid in car insurance my entire life. I could have I could have bought 10 Ferraris probably. What's the use until you actually have an accident? And yeah, so anyway, so yeah, Medicare Part A is free for most people. Zero premium. It's not free because there's deductibles and all the rest of it, and you paid for it your entire life when you paid FICA Medicare. But it covers the hospitals. Part B covers the doctors, and but yeah, you really need to get something to cover in all the gaps. Ed, I've tried calling Social Security Administration for 3 days in a row to see if I can draw off my ex-husband's benefits. I am on disability, will be 59 in March. Divorced over 10 years. Yeah, there's no use in calling. If you're disabled, well, this is an ex-husband, so it doesn't sound like that person is deceased. So yeah, so you wouldn't be entitled to DWIB, disabled widows benefits. and that person is X, sounds like that person is still out there alive and kicking. Yeah, you wouldn't be able to get survivor benefits, and that starts at 60. So the sooner you can start benefits from a divorced spouse is at 62. So there's no use in you really calling, unless you just want to find out, you know, they won't even give you a kind of an estimate of how much those benefits would be, because and unless you had to prove relationship, because they're not just going to give you that information to anybody that calls. So all right, let's see. Can I apply for SSDI while I am still working? Hiring on June 30th due to deteriorating health. I just have to finish out the school year at 62. For SSDI, if you're working, making over about $1,600 a month, then you can apply, but they will deny you because Social Security defines disability as inability to work. Substantial gainful activity is what it's called. And if you're making basically 1650, I guess 16 about $1,600 a month, um, then they don't consider you to be disabled. So, all right. I took my Social Security at qualified age of 66 and 2 months. I was told by Social Security I could still work. Correct. Whatever I earned, can add it on to my Social Security benefit. Is it true? Yeah, as long as you stay under the monthly earnings limit, so you can collect $2,000 from Social Security and 1950 from work. If you earn over that, then they're going to hold back $1 for every $2 you go from Social Security. All right, let's see. I have a question. If my full retirement age is 67 and I wait a full year to 68 and apply for SSI is welfare, so you just mean Social Security. Then get 8% more. Yes. If you delay retirement for a year, then you get that 8%. If you're past your full retirement age. If I wait only too much, do I still get 8% more? Yeah, it doesn't matter what your birthday it is. Well, I guess it does because 67 is birthday, but yeah, 66 and 8 months and 66 and 6 months, it didn't matter what your birthday is. But now that you're 60, the full retirement is 67, I guess it does. But yeah, every full 12 months you wait, you get an 8%. So if you wait the 3 years, that's 24%. I only would have benefited if I waited till 70. So I calculated it was best to retire a few months before my full retirement age because I knew it wasn't going to last till 70 in the workforce. Yeah. People you need the money. So you need the money, you need money. Pretty easy decision there. With the VDRC, the voluntary delayed retirement credits, is that also automatic? No, that is 100% not automatic. You actually have to go in there and, voluntary suspend your benefits, and you have to fight a little bit because they don't know what not many people do it. So the people in the back know about it, but when you call the 800 number, those are generalists. They're supposed to know a little bit about everything, but this is something that not many people use, kind of insider secret, I guess. And then if you go to a Social Security office and you're able to get in the door nowadays, the people at the front windows are generalists. So when you get an actual appointment with what's called a Title II CS, a Title II of the Social Security Act claim specialist, then they'll know what you're talking about, unless they're new. And yeah, anyway, but yeah, you actually have to go in there and get it done. What is the process? My attorney was paid fees twice. Wow. And returned back one payment. The SSA never contacted me about the overpayment. What's the Social Security process? Yeah, well, the process is not to do that, I guess. So there's the process went out there. Yeah. So somebody, was it the 7, 8, I think it's what, $9,200 now. This is an attorney's fee is someone that files for Social Security disability and they use an attorney. So looks like you used an attorney, and for somehow along the lines, Social Security paid that attorney twice, and the attorney returned it, and now you should have a credit on your record that they should be returning to you. So yeah, reach out to Social Security and say, hey, give me that money. That was my money. And again, as everything else nowadays, I would contact your congressperson and say, hey, tell Social Security, give me my money. And number two, what are you making? What are you doing to improve customer service? And don't be like, Clay Higgins from Louisiana and try to, distract people. And I did a video on that yesterday. So, When will Social Security be geared up to actually implement the new law? Yeah, the Social Security Fairness Act. If I did a video on this 3 or 4 days ago, that the Social Security Fairness Act was for all intents and purposes, it was 2 sentences. So now Social Security has to turn that into, okay, what about this situation? What about this situation? They have to program the computer. They have to write the details of the new law. And now with the Supreme Court Chevron decision, it's going to take longer. And so, yeah, it's going to be a while. All right, we're getting close. Let me toward the end there. Let me see if I can find some people that I've never seen here before. Peter, my government jobs, ASU 79, most positions short term, 3 not work would have any effect. Okay. So, yeah, if you paid when you worked at Arizona State University or wherever, was it Maricopa Community College, probably MCC, since we're talking Arizona. Um, I'm not sure about those. Did you pay Social Security, FICA when you worked there? If you did, then doesn't apply to you. I am 69 and will turn 70 in January 2026. When should I apply to ensure payment reflect my waiting until 70? Yeah, a couple 3 months before you turn 70. So start your benefits the month you turn 70 because it doesn't increase after that. Rose, can I choose a plan G or N when I retire and not be denied? I'm still working and plan on working until age 70. My employer has more than 20 employees and I have current insurance. Yeah, it's based on your B date, is basically when you start your Medicare Part B, as in boy. So no, if you don't have Part B now, you declined it because you're smart and you didn't want to waste $185 because you do have credible coverage. So yeah, when you're 70 years old and you stop receiving health insurance from work, or 75 or 85 or 95 or whatever the case may be, they cannot deny you because you're essentially new to Medicare. Yep. What can I enjoy retiring at 65 when I waking up with aches and pains and looking at my yeah. All righty. Hey, the alternative to getting old is not getting old. And I prefer, yeah, anyway. My wife works. I retired last June. We have 2 kids under 18. I'm 62 and a half and haven't drawn yet on my Social Security. I have a pension. If I start drawing, do kids get a Okay, SSI is welfare. So you're just talking regular Social Security. Yeah, it might be if you're not working, if you're not making over the annual earnings limit there, then it might be a good idea for you to start since, sure, your benefits are going to be reduced, but you've got 2 children that are also going to get benefits. So that probably is going to make more, definitely going to make up the difference of any shortfall in the future. Um, let's see here. Let's get some other Hannah. I'm 66 and receiving Social Security. I have an annual income of 22,000. I reach FRA in 2025. If I work part-time and go over the limit before FRA, will the penalty continue for the rest of 2025? So yeah, it's the annual. So if you're making 22,000, you're good. So it's annual. I put your YouTube channel out of my Facebook page for everyone coming up on taking on considering benefits in Medicare. Oh, you are too awesome. I appreciate it. Yeah, if you could share on YouTube, or I guess what's the big thing is Blue Sky, or we're not sure if TikTok is still going to be here. Yeah. So anyway, I think people dying like twice since 2020 for not getting a health care they needed. Yeah, there's a thing that came out that's was it 30,000 people passed away while they were waiting for their Social Security disability insurance, their claims to be decided. Yeah, that's unsatisfactory. And Social Security Social Security cannot hire anybody. They cannot put more people at the phones or help you file for your disability. They can't do any of that until Congress gives them the allocation to do that. So until Congress, your local politician, you call them up and say, okay, I don't care what about the rest of the country. How are you going to help my local office pick up the phone sooner than 3 hours? And if they give you a bunch of BS about telework or anything, like, watch my video I did yesterday on that. Tell them, call the BS. So if any politicians want to debate me on that, I'd be more than happy to appear in Congress for any of that. But I don't think they would like my opinions. Anyway, my responses. Help. I'm on survivor disability benefits. I'm 62 and have been disabled since 2012. I don't qualify for SS, or so I'm told. What do I call? Um, so you don't qualify for SSDI, the Social Security Disability Insurance. You're essentially receiving it, but um, you're even if you did, one would offset the other. So if you're receiving $1,500 from what's called you're receiving DWIB, disabled widows benefits. If you receive $1,500 from DWIB and then you file for your own and you get 700, then the 700 will offset. So you'll still get $1,500 basically. So receiving any money on your own is not going to increase your benefits because you're probably already receiving the higher benefit. And yes, you probably wouldn't be qualified for disability on your own because you're not currently insured. You didn't work 5 out of the last 10 years based on since you've been disabled since 2012. So, all right, we are over an hour and we are out of time. I'll be back again tomorrow, answer more of your questions. And please take care of each other, like,